You must have seen this crash card hundreds of times in year. We all know that all the emergency drugs are kept there, but do you really know what are the five most important emergency drugs that can help you out in emergency? Today, I am going to tell you five most important emergency drugs that every MBBS student, intern, or a young doctor must be confirmed of using in emergency. Here, I am just not giving to tell you the name, but I am also going to tell you about the indication, the doses, the formulation, and also the real world tips so that you do not freeze while using them in emergency. So let's get started. So the first drug and the most important drug is adrenaline or epinephrine. So what are the indication? First indication is cardiac arrest and also in anaphylactic shock. Its second important indication is cardiac arrest. This is the drug that is drug of choice in cardiac arrest. So, what are the doses when we use this drug? We use this drug in anaphylaxis. The dose is 0.5 mg intramuscular. This is the dose that is given in anaphylaxis or anaphylactic shock, and the dilution of this dose is 1 is to 1000. When we use this drug in cardiac arrest, this dose is 1 mg intravenous, and this is dose is repeated every 3 to 5 minutes till we get the response, and the dilution is, I have already told that, 1 is to 10,000. An important tip here is that you must be able to use the proper dilution. You can see that when we give this drug intramuscular, the dilution is 1 is to 1000, and when we use this drug in intravenous by IV route, the dilution is 1 is to 10,000. Now, how this drug is available? This drug is available as a 1 ml ampule, and in each ml there is a 1 mg of drug. So the concentration of drug is 1 mg per ml. So this was our first drug, that is adrenaline. The second most important drug is used in emergencies, atropine. Its two most important indication are, first, it is used in bradycardia, and second indication is it is used in OP poisoning. So what are the doses? So when we use this drug in bradycardia, the dosage is 6 mg intravenous, and this can be repeated 3 to every 3 to 5 minutes, and maximum dosage that you can give is 3 mg. When we use this drug as a organophosphorus poisoning, you can have to give around 2 to 5 mg intravenous and as a bolus, and then you have to repeat this drug till the secretion are dry. In organophosphorus poisoning, we have to use this drug in lot of quantity. What are the most important tips here? The most important tips is that you have to monitor something. What you have to monitor? You have to monitor the heart, right? Because this atropine drug is known to cause tachycardia, that is increase in the heart rate. Second, you have to monitor is the size of the pupil. This you have to monitor. Now, how this drug is available? This drug is also available in 1 ml of ampule, and the concentration of this drug dose available in 1 ml is 6 mg. But this is atropine is also available as 100 ml of vial. We all know that is organophosphorus poisoning. We have to use a lot of this drug. So if we take 1 ml of ampule, then we need to break a lot of ampule. So instead of that, if we have this 100 ml of oil, then we can easily take drug from the IV and give to the patient. So this was atropine. Now the third most important uh, drug is amiodarone. What is amiodarone? It is an anti-arrhythmic drug. This drug is also known as broad-spectrum anti-arrhythmics. You must have heard this name, broad spectrum, in relation to antibiotics. But this is amiodarone, is a broad spectrum anti-arrhythmetics, and its indication are is mostly used in VT, ventricular tachycardia, um, VF, ventricular fibrillation, and most importantly, those tachycardia are the resistance to shock. Shock resistance means VT and VF that are resistant to shock, that can respond to amiodarone. Secondly, this is amiodarone is also used in supraventricular tachycardia, SVT. Now, what is the dose? We give this drug as 150 to 300 mg bolus, and then we give it by infusion, generally 600 to 900 mg over 24 hours. What is the important tip here? You have to monitor two things. First is blood pressure, because this drug is known to cause hypotension. Second thing, you have to see if there is QT prolongation. There are two important things you have to monitor when you give amiodarone. So, how this drug is available? This drug is available as a 3 ml ampule, 3 ml ampule, and in 3 ml of ampule we get 150 mg of amiodarone. So this was amiodarone. Then the fourth drug is midazolam. Midazolam is what? It is a benzoyl diene, and its indication are two important indication are it is used in seizure, must status, epilepticus, and it is also used for giving sedation. Now, what is the dose? The dose is generally 2 to 5 mg. This can be given intravenous, or it can also be given by another route, that is intramuscular or buccal route, and then here the dose is 2 mg per kg. The dose is decided according to the weight of the patient. So what is the important thing you have to monitor? You have to monitor patient's respiration, because there can be respiratory depression in this case, and you have to also monitor the patient airway. When the patient gets sedated, the tongue may fall and there may be an airway obstruction. So you have to monitor two things. First is respiration and another is airway. So how this drug is available? It is available as a ampule. There is a 5 mg in each ml. So this is the ampule. Ampule can be of 1 ml or it can be of 3 ml also. And this drug is also available as a vial. In in while there is a concentration of drug in while is 1 mg per ml, 10 ml vial or 5 ml vial is also available. So this is midazolam. Now the last drug that is not the list is uh, dextrose 25% or 50%. What are its indication? It is most important indication is hypoglycemia. When the blood sugar comes down really low, then there is a risk to the patient life, and in that cases, we give this dextrose, and its dose is 25 to 50 ml intravenous push. Most important tip is we have to see patient sugar after giving this drug. Sometimes patient hypoglycemia is not corrected by this much of dose, and in that case, you may have to repeat the dose. How is it available? Most commonly, this 25% extra is available as a 100 ml vial, and 50% extra is available as a 25 ml ampule. So, in summary, there are the five drugs that are most important that we use in emergency. First is adrenaline, and its indications are anaphylactic cardiac arrest. Second is atropine, and its indication are bradycardia and OP poisoning. Then third is amiodarone, and its indication are supraventricular tachycardia, supraventricular tachycardia, ventricular fibrillation, supraventricular tachycardia, and mainly those are the resistant to shock. Then midazolam is used in seizures and for sedation, and the last drug, that is dextrose, is used for hypoglycemia. So these are the most important five drugs that you will really look for in emergency. So friends, if you found this information useful, then please give a like to this video and do share with your batchmates. And if you have not subscribed to this channel, then do subscribe for a weekly clinical dose. So see you in the next video. Till then, thank you.